Hi, my name is Dr. Jerry Bagel of Windsor Dermatology. I'd like to talk to you about what I believe is one of the most debilitating skin disorders that exists, Hidradenitis Suppurativa. Think about it. 20 years old, boils and abscesses that are draining under your arms, in your groin, on your buttock, foul-smelling, oozing. Think about the impact that has on the quality of your life. You're not going to want to go out. You're not going to want to participate with your friends. Intimacy is out of the table. Ain't going to happen. Depression, increase in cigarette smoking, increase in drug use. They're painful as well. Increase in opioid use. Hidradenitis suppurativa is a disorder also called inverse acne, but far from acne. Think of the worst case of acne you've ever seen on someone's face. The worst, and multiply it. And think about that under your arms and in your groin and on your butt and how painful that's going to be. Hidradenitis suppurativa occurs more often in women than men, more often in the obese than the thin, more often in African Americans than Caucasians. Commonly occurs between the ages of 20 and tends to burn out by 40. Great. Perfect time to ruin someone's life. Hidradenitis is caused by clogging of the sweat glands. The sweat glands get clogged, and when they get clogged or occluded, they get inflamed. And then when they get inflamed, they get red, they get infected, and they start bursting, opening. Until recently, there have been very little treatments for hidradenitis suppurativa, nothing FDA approved. Surgery, which could result in lancing and recurrence of new lesions because you get fistulous tracts under the skin, so that, like, think about strawberry rhizomes, roots, and then it grows up somewhere else and then another lesion pops up somewhere else. Systemic antibiotics help somewhat. Intralesional Kenalog could help to a degree. But a few years ago, one of the treatments that is utilized for psoriasis, as well as rheumatoid arthritis, as well as Crohn's disease, Humira, adalimumab, was FDA approved for the treatment of hidradenitis. And Humira, adalimumab, decreases some of the inflammatory components, specifically tumor necrosis factor, which is very elevated in people with hidradenitis. And by lowering that inflammation, one can decrease by at least 50% the activity of hidradenitis. There is an increase in infection, and one needs to be monitored. Nonetheless, it does improve the quality of life of many people. There are many products in development in clinical trials in phase 2 and phase 3 for hidradenitis today. Hidradenitis suppurativa is by no means contagious. It is limited to the individual, and even if you remove one nodule, doesn't mean you're not going to get another nodule, but it's not related to a contagious process, it's related to an inflammatory process. To help someone minimize hidradenitis suppurativa, I think decreasing smoking, stopping smoking, and losing weight would probably be the two recommendations I could make. Hidradenitis has a genetic component with multiple genes at play. There are warning signs, and they're subtle. Many times, when we see in acne, we might see what's known as a comedone, like a blackhead. Well, almost never do you get blackheads in your armpits or in your groin. And some of the first signs of hidradenitis are blackheads in your armpits and your groin. The other thing to remember is you might get a boil in your arm and another boil in your arm, and you go to the ER or you go to the surgery center or you go to the local ER and you get it drained. And to get this recurrently is not just a boil here and a boil there. And many times, since you're going different places, no one's putting it together that you have hidradenitis. So if you start having recurrent lesions in your armpits, in your groin, in your butt, you should consider the fact that these are just not isolated events and that you might have hidradenitis suppurativa, which can be treated more systemically than individually. Hidradenitis suppurativa affects about 0.2% of the population of the United States, so about 500,000 people in the United States have hidradenitis suppurativa. There's no cure for hidradenitis suppurativa. I think we're in the beginning phases of developing good new treatments for hidradenitis suppurativa. As I said, no cure. It tends to burn itself out by the age of 40 in most cases, but the scarring and the impact on quality of life through the 20s and 30s and to 40 can be devastating. I think the only natural remedies, in my opinion, is to keep a well-balanced diet, avoid alcohol and cigarettes. When being evaluated for hidradenitis, I think it's important that a patient tells them when did it start, where did it start, how many courses of antibiotics they've been on, how many times or where they've had surgery on their body, or lancing, where they've had intralesional Kenalog, kind of a history of the duration and treatment that they've had. Windsor Dermatology is the best place to come for the treatment of hidradenitis suppurativa because we are interested in people that have chronic immunologic diseases of their skin. We also know how to use biologics because of our 20-year history of treating people with psoriasis, and many of these medications are used in the treatment of hidradenitis, so we know their risks, we know their benefits, and very importantly, we know how to get medications approved through your insurance. If you have hidradenitis suppurativa, find a doctor that knows how to use biologic therapy. Find a doctor that knows how to treat psoriasis or atopic dermatitis, but that's comfortable in using biologic therapy, because that's your best bet right now in getting the right treatment. I think the treatments at Windsor Dermatology for hidradenitis suppurativa are cutting edge. We will use the best treatments available on this planet for you.